Honor and pleasure to introduce my colleague, my mentor, my friend, Dr. LaJune Oliver. LaJune Elder Oliver is a board-certified family medicine physician and obesity medicine specialist with the Southeast Permanente Medical Group. Dr. Oliver currently serves as the South Area Chief for Adult Primary Care. A native of Georgia, Dr. Oliver received her Bachelor of Science degree in biology from Emory University and Doctor of Medicine degree from Medical College of Georgia. She completed her internship and residency at Emory University School of Medicine. Dr. Oliver's passion is promoting healthy lifestyles and prevention to her patients and community. She has been active in the design of a comprehensive weight management program at Kaiser Permanente, Georgia. She has championed the work of patient-centered medical home recognition for the organization, and she continues to promote a culture of high-quality care to the patients served. She is active with several committees, including peer review and government relations. Dr. Oliver was appointed in 2015 for a 2-year term by Governor Deal to the State Bariatric Surgery Pilot Review Panel Board. Dr. Oliver speaks to schools, churches, and other community organizations encouraging wellness and prevention. She is also an active member of Zion Hill Baptist Church in Southwest Atlanta, serves as a youth mentor, and volunteers with a number of civic organizations. She enjoys traveling, and her greatest joy in life is spending time with her family. She resides in Southwest Atlanta with her 2 children. Please help me to welcome Dr. LaJune Oliver.
Thank you so much, Sharice, for that kind introduction. To Ben, Nick, Paige, as well as to all of those joining with us from the Clayton Chamber, and for those joining with us this morning, it is certainly my pleasure to be here with you today. Good morning. I joined Sharice and Tom on behalf of Kaiser Permanente, and really it is our pleasure to be with you serving today. I am going to share my screen. And with our PowerPoint presentation today. So this morning, we will be talking about COVID-19, health and racial disparities impacts to our community. Just as a disclaimer, our recommendations today are made with the guidance from the Centers of Disease Control, the Georgia Department of Public Health, and the United States Department of Labor, OSHA department. This information shared is based on data just as early as yesterday from June 15th, 2020. Information is based on scientific information and national health guidance known at this time, but is certainly subject to change as new evidence becomes available. During our time of sharing today, we will talk about COVID-19. We'll review some of the disease and symptoms. We'll talk a little bit about workplace safety. We'll also talk about the impacts of COVID-19 in Georgia, as well as to review some of the Clayton County health stats, and then really talk about healthcare disparities. I know many of you have heard so much in the news about COVID-19, but just as a quick review so that we're all on the same page. Coronaviruses, of which COVID-19 is a part of that family of viruses, are very common. They are usually ones that cause the common cold and other respiratory infections. COVID-19 is short for Corona Disease 2019, which was the official name given by the World Health Organization, defining this newly identified coronavirus. It is primarily spread through person to person, through respiratory, through droplet transmission. And usually that may happen if individuals may cough or sneeze or talk. You also may rarely get exposure to the illness if you're touching surfaces or objects that have active virus on it, and then touching your eyes, nose, and mouth. Many of the symptoms range from mild, although there are some individuals who have no symptoms at all, to severe disease. Typically, individuals will begin to display symptoms 2 to 14 days after exposure. The most common symptoms are listed here from our CDC guidelines, with fever, chills, cough, shortness of breath, fatigue, muscle aches or myalgias, headache, new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, and diarrhea. This list is not completely exhaustive of all of the possible symptoms. We're learning more and more about COVID-19 each and every day. And again, just the reminder that many individuals are asymptomatic. In light of not having a known vaccine at this time or known medical treatment, the best thing that we can fight with against COVID-19 is to prevent spread. Key things: hand washing. That's vigorously washing your hands with soap and water for at least 20 minutes. If that is not available, then using hand sanitizer with at least 60% of alcohol. And remember to avoid touching your eyes, nose, and mouth with unwashed hands. We talk about physical distancing, maintaining at least 6 feet of distance, which is approximately 2 arms length with other people, and making sure that we're avoiding crowded places and large groups. And third, masking. We really strongly encourage that individuals wear the cover your mouth or nose mask. Really, when we do mask, as I've often shared with others, that really is showing our care and concern for others in the community. We do not knowingly want to unknowingly spread further symptoms and disease to others. When you are wearing masks, you want to make sure that it's close to the bridge of the nose, all the way down under the chin, that the loops are snug around the face to prevent gaps. Just a little bit about workplace safety. As employers, we know that we want to provide a safe and healthy workplace. And certainly employees want to be in a place that is safe and healthy. The OSHA guidelines on guidance on preparing workplaces for COVID-19 has a full gamut or workplace plan information for those of you wanting to make your workplace as safe as possible for individuals in the midst of this COVID-19 pandemic. Some of those key points out of those OSHA guidelines is that you want to develop a workplace health and safety plan, which includes how you're going to respond to infection. You want to conduct a hazard and risk assessment. And some of those things may be just as simple as ensuring that your ventilation system is working properly, making sure that you have appropriate signage and visual cues throughout the office. You want to implement infection preventive measures, promote hand washing. As employers, we want to promote hand washing, provide alcohol-based hand rubs in places, ensure that that we have established a cleaning routine throughout our offices, making sure that we regularly disinfect high-touch areas. And certainly, if there is exposure or suspected or confirmed COVID cases, then we want to step up and have enhanced cleaning. We also want to establish and support policies and practices for social distancing. That's looking at our workspaces, looking at our common areas, discouraging the use of sharing others' desks and phones and equipment whenever possible. And if able, to adjust our business practices to reduce close contact, not only with our staff members, but with other customers as well. You want to allow and again encourage cloth mask coverings. And there's also too, whatever the workplace environment may be, that you have an appropriate personal protective equipment that's in accordance with OSHA guidelines. And we want to encourage sick employees to stay home. Oftentimes, especially with our baby boomer generation, and even for many of us with a very strong work ethic, we really try to push ourselves to work regardless of how we feel. But really in this COVID-19 environment, if our employees are not well, we want to encourage them to stay home, to seek the care that they need. This helps to not only protect them, but also to protect all of anybody else that's in the workplace environment. Let's talk a little bit about the Georgia data for COVID-19. As of yesterday, June 15th, Georgia had 58,414 confirmed cases of COVID-19. There were 22,494 deaths and 9,322 hospitalizations. Specifically, since we are talking about Clayton County has had 1,440 confirmed cases. That represents about per cases per 100,472, the total deaths of 72, and hospitalizations of 202. Many of you have already heard of the risk factors for COVID-19, but just wanted to highlight those that are a little bit more senior in age, or 65-year-old individuals, particularly also those that live in nursing home or extended care facilities. I do want to highlight chronic lung disease, serious heart conditions, severe obesity, and diabetes as really significant risk factors. Just on yesterday, the CDC released additional data as it relates to COVID-19. This was data, again, this is the early release from June 15th, just on yesterday, from the CDC Morbidity and Mortality Weekly Report. They indicated that hospitalizations were 6 times higher and deaths 12 times higher for COVID-19 individuals that reported underlying conditions. As of May 30th, the most common underlying conditions were cardiovascular disease in 32% of the population, diabetes in 30%, and chronic lung disease in 18%. COVID-19 and race. There have been numerous studies that have indicated that African Americans and minority communities are disproportionately impacted by COVID-19. The severity of the disease is higher, hospitalizations are greater, and the rates of death when compared to white non-Hispanic populations are higher. Again, CDC just published on yesterday some additional information about confirmed COVID cases by race. Among nearly 600,000 people who were sickened and whom the CDC has race and ethnicity data, 33% of patients were Hispanic, although they only make up 18% of the US population. 22% were African American, yet only constituting 13% of the population. And 1.3% were Native American, nearly doubling their representation in the overall population. Again, we see the statistics are sharing and bearing out that minority populations are significantly at risk for COVID-19, not just in confirmed cases, but again, in hospitalizations and severity of disease. This is just a look at the Georgia data, again, from the Georgia Department of Public Health. And it really shows and points out again, and it aligns with the national data. African Americans have the higher rate of infection, even though, again, less individuals within the population. But here in Georgia, African American women make up more of the most confirmed cases of COVID-19 than any other group. There also is a large number of unknowns before Georgia was collecting race and ethnicity data, but many of those are thought to also be part of the minority population. I wanted to share a little bit from the Emory Healthcare 2019 Community Health Needs Assessment as we take a look at Clayton County's data. We look at specifically access to care. In this particular graph, it shows the population per primary care physician. So in other words, when we look at the Georgia data, for every one physician, primary care physician, they usually are caring for about 1,520 individuals within the community. We really are not doing so well nationally. We rank 42 out of 50 states in primary care physicians and 46 out of 50 states when we look at being able to provide care for dental, in terms of dental and mental health. If you also look particularly at the Clayton County numbers, you see that even that is quite concerning, that for every one primary care physician, that physician is usually caring for about 3,540 individuals. We see those high trends also with dental care, and we also see significantly higher trends with mental health care. So what that entails and shares with us is that access to care really is a significant burden, not just in Georgia, but certainly here within Clayton County. And this can also impact, particularly for our employees, as well as for the employers that service and primarily service Clayton County. Having such lack of access to care can significantly impact the health and well-being of all of those that are working. Just a little bit about infant mortality. Clayton County, as you see, has a significantly higher infant mortality rate than the state of Georgia and for some of the surrounding counties. When we look at individuals and percentages of adults that are reporting poor or fair health, Clayton County again stands out with a higher percentage of adults that are reporting poor health. When we look at diabetes rates, Clayton County, again, sadly, outshines Georgia in the number of diabetes. And as we talked about, again, puts Clayton County Clayton County residents at increased risk for other health outcomes or worsening health outcomes with many of these conditions. And again, lastly, we want to talk about the obesity rate. 35% of Clayton County residents are obese when we compare those to 30% in Georgia. I also included the smoking rates, which also can significantly impact cardiovascular disease. Again, this data is as recent as the 2019 from the county health rankings reported to us by Emory Healthcare. Let's talk a little bit about social determinants of health. Many impacts that are contributing factors to COVID-19 and healthcare disparities. We know that there are many impacts socially that impact the disparities that we see in outcomes, particularly for our minority populations. Food insecurity is big. Issues with housing, particularly knowing that many minority populations live in densely populated housing or multi-generational families. Things like distances from fresh groceries and produce or distance from medical facilities really can impact the care that individuals receive as it relates to health care. Other things that socially impact and contributed to this disparity in healthcare include transportation or individuals that have low income jobs. We particularly saw this with our COVID-19, where many individuals had the opportunity to maybe telework or to adjust or to work from home. But for individuals with low income jobs, they have lack of paid sick time. So if they don't go to work, they don't get paid. Lack of medical benefits or insurance. So again, impacting their access to care, and individuals particularly that need it and may depend upon public transportation puts them at risk for not only COVID-19, but also worsening health outcomes. This information comes directly from the CDC that talks about underlying health conditions and further speaks about access to care. And for individuals not having health insurance, when we look at our Hispanic population when compared to whites, they're 3 times as likely to be uninsured. And for African Americans, they're twice as likely to be uninsured. In all age groups, African Americans are more likely than our white counterparts to report not having been seen by a doctor in the past year because of costs. When there is inadequate access to care, there also, again, continues to drive um, poor health outcomes. There's longstanding mistrust of the healthcare system, language barriers that are also contributing. In terms of serious underlying medical conditions, again, African Americans experience higher death rates and higher prevalence rates of chronic conditions. The death rate from COVID-19 is higher in minority populations, as we've already talked about. But interestingly enough, when we account for income, health insurance coverage, rates of obesity, and rates of diabetes, as well as public transit use, if we account for all of those, still the death rate for COVID-19 is higher in minority populations. There may be, we want to consider other things that also may be contributing outside of those factors to healthcare disparities and poor outcomes. As we talked about, the mistrust of healthcare has many historical roots and contributes to those health disparities. We just reported, as the CDC shared, that African Americans have reported less likely going to see a primary care physician in the past year. Some of this is due to cost, but certainly trust is a big component of that. And so when there is mistrust, again, that contributes to individuals not readily seeking the care that they need. Trust is a vital component in patient decision-making and is thoroughly important to that patient-doctor relationship. In addition to mistrust of healthcare, we also look at and have to look at systemic inequalities and discrimination. As we see so much that is happening in our current social climate, we know that there are underlying inadequacies, inequalities that are definitely contributing to healthcare disparities and poor outcomes. When we look at those systemic discrimination, then that can often lead to chronic and what we even call toxic stress, which again, for many individuals can contribute to poor outcomes. I was reading a study that talked again about African Americans, particularly even those that are that maybe have higher positions in certain companies, that certainly have achieved educational status and things of that sort. And it mentioned that still many of those individuals, because of chronic stress, maybe because they are first generations in their own families to achieve education, or because they are feeling that increased pressures from discrimination that they have to be better or even do more and go beyond even what their colleagues are doing, that contributes to chronic stress, which then we know also impacts cardiovascular disease. And then this is implicit bias. Again, as we talk about, particularly in employment, in a workplace setting, implicit bias. And the truth of the matter is that we all have some degree of implicit bias, but it's really how that we handle that. I mean, you may ask, what is implicit bias? And those are maybe stereotypes that we may even often unintentionally have in the back of our minds that may cause us to think differently or to react differently to a group of people, just based on those particular stereotypes that we may not have even witnessed ourselves. How do we address mistrust and how do we reduce stigma in the workplace? So some of the things that we talk about in addressing mistrust is to make sure that we show respect for all people. We want to address the role of implicit racial bias. And again, as I just mentioned, that is often unintentional, But as employers, we certainly have the obligation, and even as employees, that we want to talk about, to bring these issues to light, to have conversations about implicit racial bias. We want to acknowledge that there are gaps in healthcare disparities and realize that that is resulting from a myriad of other social determinants of health. We cannot separate healthcare outcomes, healthcare disparity from what's going on socially, from those things, again, from food insecurity, from housing inequalities, from transportation issues, from lack of access to care. We cannot separate those social determinants from acknowledging the contributing factors to gaps in healthcare disparities. We want to hold our policymakers accountable to address these issues so that we can improve the overall health of our minorities communities. We want to be advocates of change. What else can we do? So I encourage you to know the facts. You want to share them, dispel myths, not just about COVID-19, but other health conditions and about other cultures as well. We want to stay updated about COVID-19. The CDC prepares weekly updates as it relates to COVID-19 and can often shares the most up-to-date information that's readily accessible. We want to show compassion and support, especially during this time of COVID-19. And again, as we are dealing with many of the social injustices that are going on currently in society. We know that our words matter. So I challenge you to lead where you are, wherever that is, if that's in your home, in your workplace, in your community. Choose your words carefully. Make sure that we are avoiding blaming others and also making sure that we're listening to others and really seek to understand. Speak up if we hear misinformation that's being conveyed or if we see mistreatment of others. And that can be hard to do, but we really want to make sure that in all that we do and where we are, that we have a speak up culture, that we really, if we see mistreatment or hear information, that we want to address them, that stops the continuation of myths and stereotypes, as well as also is one way that we are addressing that implicit bias. And certainly we want to reaffirm those values of inclusion, diversity, and acceptance within your organizations, within your workplace. And make sure that you are ensuring the physical safety and emotional wellness of all of your employees. Certainly when employees feel that there is a place and that as employers that they're cared for, that their safety is top of mind, if their emotional wellness is top of mind, that increases employee loyalty, it increases productivity, and it certainly makes your company and in that environment a great place to work. Any questions? Thank you so much for this opportunity to share.
Thank you so much, Dr. Oliver. I believe we do have a few questions that have popped up in our chat area. One of them was from someone asking, I heard COVID-19 is getting better and there's no chance of reoccurrence. However, looking at the charge, it is not. Besides exercising 6 feet apart, social distancing, and washing your hands, does daily exercising help?
Well, I would say yes, that daily exercising does help because, again, when we exercise, we're improving other parts of our health. We're improving our mental well-being. We also are improving our physical well-being. We know that exercise also helps to boost our immune system. And so when you have an immune system that is intact, that certainly allows you to be able to fight off the other risk of infection. I will say that just a word about testing, and there's so much, again, that we're learning about COVID-19 each and every day. And so I think that there's still more studies that need to occur for us to really understand whether or not, if you've been infected with COVID-19, if you are at risk of developing COVID-19 again. So there's opportunities, as we know, that viruses mutate, and that's where they kind of change a little bit. So we aren't quite sure, again, if you are at risk of contracting. So we still encourage you to take those precautions, still want to socially distance, still want to mask as well. And again, as we learn more about COVID-19, many of these recommendations may change, but right now we may not know. So again, I encourage you, again, as we talked about with the exercising, that really does help as well.
Then we had one question that was emailed to me. And Dr. Oliver, the question was coming from the business community and other government entities. What can we in Clayton County do to help improve the overall health statistics of our residents? Are there things that we should be implementing besides offering health insurance to our employees? Are there other things that we can do to get these numbers to improve? Because it is a great concern to everyone, I think, when you put those statistics up there about Clayton County in comparison to the state.
Yes, yes. I think there's the first thing is having the awareness. And I think that is so important for our business community to have an awareness, to keep your pulse on what are those health statistics. So really making sure that the local Clayton County Department of Public Health are sharing those numbers with you. In addition, you may want to consider wellness programs from your employees. And so implementing things such as stretch breaks when we talk about exercise, or encouraging individuals to really focus in on health. There may be things as simple as changing vending machine options that you have within the workplace, maybe replacing some of the sugary drinks and snacks and things of that sort with more healthier options. And again, just providing an opportunity to really talk about health and wellness. There's many options in terms of Weight Watchers that you may have on site. There may be, again, encouraging individuals to exercise during their breaks. I think, too, as colleagues and as employers, we really want to make sure that our environment is conducive to emotional wellness of our employees as well. And so as we talk about those things, then we look at our core processes within our workplace that we might need to improve.
Right, and then we have Chase Moore who has a question. And Chase, I unmuted you so you could ask your question.
Oh, great. Thank you. And good morning, everyone. Dr. Oliver and other panelists, I'd love to get your opinion on how we might, from the university, Clayton State's standpoint, play a more active role in helping our surrounding communities, attain better health and wellness. What do you see as the university's role in that?
Did you hear that one, Dr. Oliver?
I did. I'm sorry. So yes, I wasn't sure if that was directed to me or to the group
Yes,
to the panelists. And so again, when we talk about Clayton State as an academic institution, certainly there is opportunity with sharing information and educating. I know that when we talk about health stats and we talk about information that we think that most people commonly know, there is a surprise that actually individuals don't know. So we want to do what we can to raise the health literacy. So I think from an academic institution, Clayton State certainly increasing education regarding health outcomes. I also think too, as you are sharing with your students that are there, making sure that they develop healthy habits as they are matriculating through their college environment. And certainly as an university, an institution, supporting other organizations. So again, when we talk about that educational component, maybe going out and being willing to share at certain offices or certain employer groups, I think that would certainly make a big difference.
Just also like to add that we have been in partnership with Clayton State University, and Tom and Trey, we can definitely continue the conversation offline to see how Kaiser Permanente and Clayton State can specifically partner to address some of the healthcare disparities that Dr. Oliver brought up.
Thanks again, Dr. Oliver. There's been some great questions. I'm gonna say this is our last one, and if we don't get to your question, please email it to the chamber and we'll make sure that it gets to the correct folks and get those answered. But I'd like to believe our very own board member, Audrey King with Georgia Power, has been unmuted. And Audrey, would you like to ask your question so the whole group can hear?
Certainly, Ben, thank you guys so much. And Dr. Oliver, thank you so much for such a wonderful message highlighting everyone on the statistics around COVID-19. My question to you is, so many have projected that this could potentially surface again in the fall. And my question for you is, are we prepared from some of the things that we've already learned and how we would respond to minimize the possibility of another shutdown and the overwhelming impact on the healthcare system?
Yes, I do think that certainly allowing us time to take a step back has allowed us to more readily prepare and anticipate what may be occurring potentially in the fall. So this has allowed us to increase and, first of all, to look at our core processes as a healthcare organization, our hospitals, and how we handle this pandemic. It allows us to also have better equipment in place. So our temporary facilities, being able to have those up and running, making sure that we secure adequate PPE, the personal protective equipment. We've also had time to do that as well. So this time of, I would say, reduced activity in our nation and across our state has allowed us to become better prepared for the fall. We do, again, though, still, even with those close, with the preparations that have been made, we still cannot really stress enough, though, that we still want to take those necessary precautions and make sure that we're spreading that throughout our community and workplace.
Thank you so much again. We appreciate it, Dr. Oliver. Thank you to you and your team for providing tremendous support for our community, especially during this tough time in this pandemic. So in recognition of you joining us this morning, the Chamber is making a donation to the House of Dawn in your honor. And thank you again for this presentation and the information that you've provided us with. So thank you.
Thank you so much.
But before we adjourn this morning, we have some great door prizes to give away. And I'm going to allow our chair-elect, Ms. Truist Braxton, to do the honors. Therese? You're on mute, Therese, sorry.
Now you can hear me. Thank you, Ben.
No problem.
We do have two great door prizes. I know you understand the importance of having PPE. And so we do, again, have some Clorox wipes right here in Clayton County that have been donated for our first door prize. Paige, will you please pull that first name? And the winner is?
The winner is Karen Reiser from the Clayton County Water Authority.
Oh, wow. Great.
So
Congratulations.
Karen, we will get those over to you.
All right. So do we have one more? So we have one more page.
Right, this is a seat at our next Truist Networking Series breakfast in July.
Which we do try to plan to have in person at the Morrow Center. And the winner is?
Sylvia Dennis Ray from the Alzheimer's Services Center. And I think Sylvia is still on too. Congratulations, Sylvia.
Congratulations, Sylvia. So we so look forward to seeing you live and in person at our next Truist Networking Series event. And that should be on July 16th. Back to you, Ben.
Thank you so much, Therese, and congratulations to our 2 winners this morning. Thanks to all of you for connecting with us. We know that everyone's schedule is busy, and we appreciate you allowing the Chamber to get together as members and a community and continue to serve. We want to be a resource for everyone. We want to continue to collaborate with so many of our partners here in the county to make it a better place to live, work, and play. As we close, I would like to again thank our presenting sponsor, SunTrust, now Truist. Thank you, Nick, and your team. And our monthly sponsor, Kaiser Permanente. Therese, Dr. Oliver, Tom, thank you all so much for all that you do. Please watch your inbox for upcoming learning and networking opportunities through the Clayton County Chamber of Commerce. Our meeting is now adjourned. Thank you all for joining us. Thank you, Paige.
Thank you so much.
Hi, everyone.
Thanks again.